Thanks for joining us for this extended talk to our Men's Health Special Close Cut Conversation. I'm Community Affairs Director Casey Jones from Wood TV, joined by Dr. Ken Dode, a primary care physician, sports medicine over at the University of Health Michigan West in Cedar Springs. We just heard 4 men's health journeys, bravely and courageously sharing their personal stories about some of the issues that men typically face more often and don't always talk about all that often either. Heart disease, diabetes, prostate cancer, and mental health. Dr. Dode, one of the things that I think was sort of carried throughout with all 4 of our men and their journeys was this idea that, well, men don't talk about that, or I didn't know about that, or I didn't know what the symptoms should have been. What can men do at home right now to make sure that they're able to bring up their health concerns?
I think the first thing is knowing that you're going to need to see a physician at some point in your life, probably sooner than later. If there's something wrong, make an appointment. If there isn't anything wrong, that's great. Get in for that yearly physical. And we'll get things checked out. I mentioned before that Mustang that I've got, and if I had a dead battery and someone said, gosh, that all you need to do is change the battery, and I said, I don't like to talk about batteries, that's not really a helpful answer. So you're going to have to talk about it. Find someone that you're comfortable with. If you see something in a man in your life that is an issue, you think something's changed, or they start complaining of something that they think is really minor, get an appointment, call the office, let's get it addressed.
Another reoccurring heavy theme throughout this is family history as well. We heard Tom Turner, who shared his story about diabetes and heart disease, talk about he knew his family history. How important is it for people at home, men specifically, to know that these things run in their family, and what are the implications of that?
It's important. Sometimes it doesn't always follow that family line, but the more you know about what you have in your history, the better we can take care of you, the easier it is for us. So ask those questions. If you're that younger generation, ask Dad and Grandpa, what kind of issues have we had in the family? And bring those to us so that we can kind of start picking those apart and seeing what we need to do.
When you have someone come into your office and they share their family history, is there a conversation that's had that you need to let the other people down the line know about this as well?
Yeah, especially some of the more major issues. If we identify something, we say, look, this is something that's going to run in the family, so you need to be aware of this. Other generations need to be aware of this. They're just at a higher risk.
One thing that I found interesting in our special there was Alejandro, who shared his journey with prostate cancer. He had a great line that I think a lot of men at home can recognize themselves in. Let's take a listen here.
It's very confusing because sometimes, my arms hurt and I want to go to the doctor, and I said, maybe next week. And all of a sudden that pain goes away.
So Dr. Dode, I think, there's a lot of men who have had that conversation with themselves. I'll deal with it tomorrow. What is that threshold of signs and symptoms that I need to reach before I call the doctor?
So everybody's heard that old joke of doctors take 2 aspirin and call me in the morning. But that joke is call me in the morning, not call me in 3 weeks or 2 months. So if you think something's wrong and it's not an emergency and you want to wait until tomorrow or give it the weekend, that's fine. But if it's still there, then you need to pick up the phone and get an appointment so we can figure out what's going on. Hopefully it's nothing. I love those appointments when patients come in and say, I have this little issue, and it ends up being something we can fix easily. That's great. So I'm never upset to see a patient for something easy like that.
When you hear the numbers about heart disease in men in America and the fact that 1 in 4 deaths of all men will likely be caused by heart disease this year, it's startling. And we hear about some of those close calls for our men in their health journeys. Jonathan specifically, who went into cardiac arrest at an intersection and was, miraculously, as he calls it, revived there by a fire chief who just happened to have the defibrillator there. But Jonathan says, he knew he had cardiomyopathy in his family. He had never been diagnosed with it, but he had never really experienced any signs or symptoms to let him know that he should get checked. So if I'm not experiencing any of those signs or symptoms to send me to you or to another doctor, how do I know that that's even a possibility?
Well, sometimes you don't, but a lot of that stuff we'll pick up on a yearly physical. There's some screening blood work that we can do, and we can get a lot of information out of that. And kind of give us a direction as to where to head. If we start to pick up some abnormalities, then we start working those up further.
Tom Turner shared his diabetes journey. You know, he former athlete at Michigan State, played basketball, loved basketball, continued to do it to keep him in shape. He talked about his family history and, you know, the problems that he had there, but also about how his diabetes and leaving it uncontrolled led maybe to even further heart health problems for him and some other issues as well. But he also said, a lot like Jonathan, I didn't have any signs that I knew of. You know, I mean, I'm sure he was experiencing something, but he didn't know about him. And so he left it uncontrolled for maybe too long. So what signs are you looking for if you're a pre-diabetic? And what are the ramifications if you do leave them uncontrolled?
So one of the things that you'll find is excessive thirst or excessive urination. It's usually in people with a higher BMI or heavier set, but it doesn't always have to be. Certainly the family history is a big part. What happens is, as the blood sugar increases over time, the little arteries around the heart, the brain, the kidneys make changes. It's like picking up a dumbbell and doing this all day long and just saying, I'll just tell the muscle not to get bigger. It's going to happen. They don't know why the blood sugar is high, and they don't really care. They just make those changes. So then you end up with arteries that aren't working as well. You have a blood supply issue, and that leads to all kinds of issues down the road.
I think some people might be intimidated by thinking, well, I have to prick my finger, and then I've got to do math to figure out how much insulin I need. You know, but as Tom demonstrated for us, it's gotten relatively easy with technology here. You know, he's got the pump connected to his body, programmed to his body. Should people be intimidated by a diabetes diagnosis?
No, I have not met a patient that we can't get under control relatively easily. It may take a little bit of time, but we can get you there on a regimen that you can follow. So it's overwhelming at first, but it doesn't have to be. Once you get into the regimen and you know keep those follow-up appointments, and we continue to check things and make sure we know where we're at, we can typically get it under control.
Let's talk prostate cancer now, Dr. Dode. Alejandro talked very openly about what he was feeling, and I don't think that there's a lot of men that disclose or get that comfortable with the conversation. You know, he said, I had a burning sensation during intercourse with my wife. Yeah, that's a red flag to go get checked out. But sometimes with 1 in 7 men in West Michigan being diagnosed in their lifetime, sometimes the signs aren't always that apparent. What should men be looking for? And is a cancer diagnosis a death sentence?
No, it's not, especially if we catch it early. What you're looking for is changes in your urinary habits. So if you urinate more often, or you feel like you're urinating often but you're not emptying your bladder, so you have to go again in 20 minutes or half an hour, those are signs that prostate may be enlarged, which may be a simple fix and not necessarily cancer. But we want to catch it ahead of time. We want to do that blood work, make sure we know what's going on, so that if that is a cancer, we can get it fixed.
How easy is that blood work to do? I mean, how easy is that process for a man?
We do it at every physical. It's a needle poke. We get the blood, we send it off to the lab, we have it back sometimes within the same day or within a couple days.
I want to talk mental health real quick, because you know, a lot of men will come to the doctor because they've got a physical ailment. Mental health is not something that is oftentimes talked about, whether it's at home by a man or in a doctor's office setting. If I'm a male coming to a doctor's office, what should I know about the importance of bringing up some of those emotional feelings in a conversation with the doctor?
It's important. It's very common. There's also a screening tool. It's a questionnaire that we use, again, at every physical. They're very broad questions, and I can take a look at that. It's a simple 7-question, 9-question, depending on how you do. And we'll take a look at that, and I'll ask, this looks like maybe you've got some depression issues or some mental health issues. Let's talk about them. Sometimes all that happens is that you were fatigued, but you've been working a lot lately, and it's not a mental health issue. That's great, but that's one way that we try and open the door for patients. And then know that it's common. I have lots of patients that have mental health, depression or otherwise, and we can usually treat it.
We talked about really 4 specific health journeys that men typically face, but there's a long list that men more often will face than women. What else are you looking for, male specific, in a doctor's screening that I at home should be aware of as a man?
Oh, we check the major things: kidney function, liver function, check electrolytes, making sure that cholesterol's in a good range and we don't need to do something about that. Check for diabetes, check the prostate levels in the blood work, mental health screens, and then just kind of overall health.
And just lastly here, Dr. Dode, I want to give you the chance to speak directly to any man at home who's trying to take control and prioritize their health, whether they're active or whether they've got some physical ailments. What actionable steps can they take right now to take their health back?
I think we've talked about it a lot. The first is find a physician and get your physical done. It's easy to communicate with us now. The different medical records, there's an app on your phone. You can send me a message and I can look at it in the morning. So if you have questions, send me the message and we'll decide, is this something that we can handle down the road, or do I need to see in the office the next day or in a week if it doesn't clear up? It's really easy, but you've got to ask those questions. I can't read minds. So we've got to know what's going on. If you have those issues, then we can address them.
Dr. Dode, I want to thank you so much for your time. Hopefully you at home, you were able to take away some helpful, useful tips that'll help you take control of your health or the health of a loved one that you may have in your life. I want to thank you for joining us for this extended close cut conversation. For Wood TV 8, I'm Casey Jones. Stay healthy and hopeful.